All right. Jumping in, we're talking about the one big beautiful bill and the way that tax breaks are mostly benefiting people with higher incomes. Unfortunately, the savings that people with low and middle incomes will experience don't account for what many of those same people will pay in higher grocery bills, higher health insurance premiums, and higher healthcare costs. And many of them will be impacted by cuts to health coverage and food assistance and other basic needs programs. The vast majority of HR 1's tax cuts are reflected in tax breaks for people with incomes above $500,000 per year. And generally, the more they make, the bigger the break. So, how, one might wonder, are we paying for the revenue reduction that comes with such a giveaway? In part, it's by cutting spending on healthcare and food assistance. It's essentially a reverse Robin Hood. Today, we're going to walk through some of the cuts in the bill, starting with those to healthcare. HR 1 seriously undermines the coverage gains won through the Affordable Care Act and represents a major step backwards in terms of protecting people from the physical and financial dangers of being uninsured. The attack on healthcare access is manyfold. The federal government is requiring states to implement a Medicaid work requirement, despite knowing that such requirements are proven to be burdensome to states and to take away coverage from eligible and working people. It adds barriers, making it harder to get enrolled and stay enrolled in coverage on both the marketplace and through Medicaid. There is hardly one corner of the bill that doesn't include an attack on immigrants, and the health policies are no different, taking eligibility away from many legally present and documented immigrants. It introduces new out-of-pocket costs, and HR 1 intentionally let marketplace subsidies expire, leaving millions of people with no way to afford coverage at all. To give an idea of how things have changed for immigrants, I'll first say a bit about how things were. Undocumented immigrants are not and were not eligible for Medicaid or Medicare or subsidies for marketplace coverage. With some exceptions for unborn children or for emergency medical services, any coverage for this group has to be state funded. Qualified non-citizens is a group that historically has included green card holders, refugees, and asylum seekers. For this group of lawfully present immigrants, to enroll in Medicaid, you would need to have lived in the United States with the qualified status for at least 5 years, unless it's someone who is pregnant or a child and living in a state that makes an exception for those groups. On the marketplace, people in that 5-year waiting period could qualify for subsidies to buy coverage. To enroll in Medicare, you would need to first meet the 5-year requirement and then either pay for coverage or have paid into it for 10 years of payroll taxes. Now, under HR 1, some legal immigrants, like refugees, lose eligibility for Medicaid completely. On the marketplace, at the beginning of this year, subsidized coverage became available to a much narrower group of immigrants. For Medicare, some groups, like refugees, will no longer be able to pay into coverage, regardless of how long they've been legally present in the United States or how long they've been paying into the program through their taxes. Next year, such a senior who is currently enrolled in Medicare will be automatically disenrolled from their coverage. Under the Affordable Care Act, states gained the option to expand Medicaid eligibility to adults with low incomes. HR 1 sabotages that coverage pathway by increasing paperwork and adding a work requirement, by increasing copays for some enrollees, by removing some of the financial incentive for states to expand Medicaid that haven't yet, which Ohio did in 2014. HR 1 doesn't just attack Medicaid expansion, but Medicaid as a whole by significantly limiting the way that states can finance Medicaid or raise Medicaid funds in their states. Over time, this will put budget pressures on Medicaid that could force cuts across the program if additional revenue cannot be raised. Also, Ohio specifically is heavily reliant on provider taxes to cover the state's share of Medicaid financing and could be disproportionately affected by HR 1's provisions. This all puts pressure on the budget that risks cutting healthcare over time. Those cuts could be to the home and community-based services that enable people who would otherwise be in a nursing facility to stay in their homes and receive care, or it could mean cuts to the Medicaid expansion program. Under the weight of all of these changes, states may be forced to scale back Medicaid so that it's available to fewer people or it's more limited in what services it can offer and cover. States may need to make cuts to reimbursements for healthcare providers. And when trying to balance their budgets, states may need to make difficult decisions to make cuts in other spending areas like education or elsewhere. Okay, let's talk a bit about this work requirement. So the work requirement applies only to the expansion group, not to every person with Medicaid coverage, and it will go into effect in most states by the beginning of next year. This requirement is harsher than any work requirements yet attempted, but we know from previous work requirements that they often fail to protect enrollment for people in exempted groups. Under HR 1, there are exemptions for groups, including people with disabilities or people with serious or complex medical conditions, students who are in school at least half-time, caretakers of children under 14, pregnant people, and veterans. Work requirements often result in working qualified enrollees losing coverage due to procedural and other issues. They have no impact on employment and they're burdensome to states. In Georgia, for example, the state spent twice as much on administration of their work requirement as it has on actual healthcare. And the program achieved a very small fraction of projected enrollment. Many people will have their health coverage taken away as a result of the work requirement. They'll be left out of the positive impacts of Medicaid expansion. In Ohio, 75% of the people who enrolled when Ohio first expanded Medicaid previously had no coverage at all. Enrollees experienced better health and protection from medical debt. Ohio hospitals, after expansion, saw the burden of uncompensated care costs cut nearly in half. Right now, almost 770,000 Ohioans have health coverage through the state's expansion program. Expansion plays an especially critical role in communities through its mental health supports for vulnerable people. There's really high need for this care. 40% of adults covered by expansion in Ohio have a mental health or substance use disorder diagnosis. Through expansion, the state also draws down significant federal investments in that needed care. Ohio received more than $1 billion in federal Medicaid expansion funds toward behavioral health services for the group in just 2024 alone. Cuyahoga County is an area where a high proportion of people get health coverage through Ohio's Medicaid expansion. HR 1 failed to extend expiring credits that helped people to afford purchase coverage on the marketplace. Without these subsidies for people with low and middle incomes, the cost of premiums has skyrocketed. Millions of people are newly strained or priced out entirely. In Ohio, for example, a 60-year-old couple with a combined income of $82,000 per year would need to pay over $15,000 more in premiums this year to keep their same health coverage.
Oh
You
my
know,
God.
right? An Ohio family of four making $126,000 per year faces a more than $6,000 increase on top of what they'd already been paying for their family's coverage. Altogether, CBPP projects that the bill will lead 438,000 Ohioans to become uninsured due to changes to both Medicaid and marketplace coverage. The bill includes several hits to hospitals and providers, especially in rural areas. We expect to see rural hospitals closing all across the country as already struggling providers are hit by the bill's many changes. This is a threat to access to care for people living in rural areas and a threat to economies in rural areas where hospitals are often primary employers and big spenders. HR 1 will add strain to rural hospitals, not alleviate it. There are lots of different estimates as to how many hospitals might be closing across states, and they're varied in Ohio, but it does seem that most of them would be in Appalachia. So, what about the Rural Health Transformation Fund? It's possible that some of us have heard of this. In response to concerns from senators representing rural states about the adverse effects of the healthcare cuts in the bill, the 5-year Rural Health Transformation Program was created. Will the money set aside in the bill for rural health offset the harms? In short, sadly, no, it will not. This isn't to say that the money awarded to states can't do real good, but ultimately the funds are temporary, only 5 years. They're not guaranteed to keep coming to every state over those 5 years, and it's simply just insufficient to make up for what's being lost. Ohio recently received almost exactly the median allotment for the first year, but the award ranks 46th in the nation for funding per rural resident. So in actuality, one of the lower amounts. Like several other parts of the bill, many impacts are timed to hurt after the midterm elections. Many cuts to Medicaid are also backloaded. You can see here that more than 3/4 of the Medicaid cuts of the first 10 years will go into effect after 2030. This adds some context to the potential impact of a finite 5-year fund. As with healthcare cuts, changes to food assistance or SNAP are manifold and include expanded work requirements, refusing eligibility to some lawfully present immigrants, shifting financial burden to states in a major way, and cuts to how much food people can afford to buy using their SNAP benefit. In addition to saddling states with a much higher share of administrative costs, HR 1 includes a new penalty for states with error rates above 6%. And I should say error rates reflect human errors, not fraud. Ohio's error rate is below the national average and on par with other states in the region. But under new rules, it would still be too high to protect from major cost shifts. This is important because, in an effort to avoid penalties under pretty unrealistic deadlines, states are under pressure to deny food assistance to more people to avoid incurring errors. In total, HR 1 will saddle Ohio with an estimated $388 million a year in new costs to maintain SNAP benefits. Additionally, Ohio is one of 10 states where counties are responsible for administering SNAP and will face a particularly harsh burden. This is going to hit Ohio in the pocket and puts people at risk of financial strain and hunger. In Cuyahoga County, almost 17% of residents use SNAP to eat. And this is all without time to get into the impacts on jobs and grocery stores and food prices for everyone. In addition to everything else, the bill marks a loss in the fight for a more equitable child tax credit, at least for now. The child tax credit was enacted in 1997, and it's been expanded multiple times since. It helps make the cost of raising children more affordable for families by reducing federal taxes for parents. But it could do much more to reduce poverty, as we saw in 2021 when it was temporarily expanded to allow families with the lowest incomes to receive the full credits. It's lifted many families out of poverty, millions. HR 1 takes that credit away entirely from many families who need the support the most, as millions of families won't receive the full credit because their incomes are too low. It also targets immigrant families, taking the credit away from kids whose parents don't have Social Security numbers. In Ohio, almost 750,000 children will not qualify for the full credit amount of $2,200 per child. While all of this is discouraging and worrisome, we want to stay rooted in our goals and organized toward a better future. Ways to do that in this moment include helping people understand what is changing in Medicaid and SNAP and ACA marketplaces, inform community members of changes to the programs that they rely on. It can look like documenting harm and continued accountability, which can be collecting stories from people who are impacted or lifting those stories up in the media, using them to hold legislators accountable. Leveraging the momentum from this crisis to build coalition power is another way to take action right now. Organize those who are impacted the most and are looking for a place to channel their anger and frustration. Build power in congressional districts of legislators who voted for HR 1. Ensure that people know who's to blame for skyrocketing healthcare costs. If you all would like more resources on anything that I mentioned today, please do let us know and we would be happy to follow up. And thank you to our friends at Policy Matters Ohio, who we pulled heavily from for a lot of the Ohio focused analysis here. And thank you all for your time.
And I think we pass it to Hannah. Thank you so much for being with us to share just a little bit about what you all are focused on and working on during, this kind of time in Ohio.
And we do have questions in the chat. So if you all want to take some time from Center of Budget and Policy Priorities to review those while Hannah is doing her presentation, then we can respond to questions collectively for a Q&A after. Thank you.
Excellent. Excellent. And it'll take me a second to work the technology. So if there's something that comes up, have at it. I'm going to try to share my screen. I did put together a few slides, and it will test my ability here. Let's see. All right. You'll cross your fingers. Think it's happening.
Yes, you just have to expand your screen because we still see your desktop. There you go.
How's it looking? Okay.
Mhm.
Goodness. Good morning, you all. I'm Hannah Halbert. I'm the director at Policy Matters Ohio. We are your friendly neighborhood think tank. Our main office is just down the road in on Perkins Avenue in Cleveland. We have an office in Columbus. I'm based out of Columbus, but I'm frequently in Cleveland. We all agree that the Cleveland office is the superior office at Policy Matters. So, and we have been allies and partners, and we hope that we've been a resource to GCC for a long time. We were with Keisha trying to pull down some federal money to make Ohio and Cleveland specifically a little more climate resilient. So don't be strangers. So anything you see in these slides, I'm going to share them with you. The links will work in those slides. Anything that you see there that comes up that you want to have a deeper debriefing with or a one-on-one, please reach out. This is my email address. Send us a note and we'll make it work. Because my goodness, there's going to be a lot of federal fallout that is just going to be left to the states and the state of Ohio to figure out. And so I wanted to just talk a little bit about what that's shaping up. So the first question is Ohio ready to handle all of this stuff that's coming our way? Big budget gaps being created across all kinds of public goods. So health, food, education, you name it, the feds are kind of passing the buck, letting the states do a lot of the dirty work of actually cutting people off. And so the first question, can Ohio deal with this, is does Ohio have the money? And the answer is actually pretty positive because Ohio does actually have the money to manage a lot of this chaos that's being created by this federal bill. The problem, however, is that Ohio policymakers have made the choice to forego that revenue in the form of tax credits and tax cuts for the wealthiest of Ohioans and for major corporations instead of applying that revenue to the kinds of public goods and services that makes all of us a little more economically secure, helps communities thrive. And so since 2005, Ohio's been on this like, we are going to get ahead and somehow have all boats rise by cutting income taxes. That's been our big state political philosophy. So since 2005, we have foregone about $17 billion in income tax and corporate taxes. So whenever we see these gaps, we're leaving a lot of money on the table that we could actually be taking care of people. Those tax cuts, I know that a lot of people, especially now, whenever it is paycheck to paycheck, hear tax cuts and may think, I could use a break on something. And so if only place I can get it is in taxes, great. Well, here's the problem. Those cuts are not only taking that revenue out of the system, it's taking it out in a way that's very unfair. And so the tax cuts since 2005, this chart's going to be updated in about 2 weeks, but you can see that the majority of those cuts have gone not just to the top 20% of Ohioans, but to the top 1%. These are people who are making on average $1 million or more, right? These are very wealthy individuals. And they get a cut of about $68,000 annually. Okay. And then you go down the scale, the middle class, all right, it's about $500 on average for those in that middle income quintile. Well, $500 whenever you are struggling with groceries sounds pretty good, but you can't pay for childcare with $500. You can't make sure you have health access with $500. Maybe that's a few copays. I hope you don't have to have any testing. And then the lowest earners, people who would be considered working poor, who are just trying to reach the first rung of stability, this structure is actually on average increased what they are paying, right? Making it harder for those who are struggling at the bottom. And so could Ohio actually do something here? The answer is yes, if we were making very different policy choices. It's not about whether we've got the money, it's about how the money is being distributed. And you all please watch my time and feel free to like interrupt. It is fine. Interrupt with questions. I can't see the chat when I'm showing my screen, but I want to give you all the opportunity to do both of those things. And the other piece that we often hear is like, well, isn't Ohio making up for this revenue by all of these so-called sin taxes? Like, my goodness, we've had the cigarette tax, we've got gambling, we've got marijuana, we've got, you name it. And if it's a sin, Ohio will tax it. And the problem with these is, and the lottery as well, we can talk about that too. The problem with this stuff is that, one, it's just not big enough to overcome the kinds of cuts and losses that we've seen in the state income tax, right? We've just taken out the foundation, the fairness foundation of Ohio's tax system. So the cigarette tax is about $712 million, and that's going down. Like that's what that is supposed to do. It's supposed to be a declining revenue source as it disincentivizes people's use, right? So that can't make up for those losses. Here at the bottom is a little bit of information about what the marijuana tax collections are. It's about 33 million. About a third of that is going into local governments of communities that have allowed dispensaries. Again, nowhere near the kind of money that we will lose, and we do lose whenever Ohio keeps cutting and cutting and cutting back on the income tax and what we're going to experience with the property tax. Okay. So lottery funds was supposed to be, we're going to fix fares, we're going to fix school funding because we're going to have lottery and that's going to go all into our schools and it's going to be great. Well, instead of actually filling up the bucket for school funding, that lottery revenue meant that they could cut taxes through the income tax. It's just supplanting dollars. It's not growing the bucket. It's changing where the dollars are coming from largely. And these sin taxes are highly regressive. So it means that those folks down in the lower end of that scale, if you think about that bracket of income, these are regressive taxes. That means those people who are lower income actually are spending a higher share of their money because of this kind of tax. So it flips fairness on its head. Are we hanging in there, doing okay? Okay. Consequences of that is this sort of stuff, right? It means that we have a public school system that is underfunded by $2.75 billion, right? So we did a fair cost of what it takes to adequately educate kids in Ohio, regardless of their zip code, and what the state would need to kick in to supplement the local tax base. That would be 2.75 million more or billion more than what they're spending now. Right? Huge gaps. Taxes are eating away at that, but also the state's insistence on prioritizing private education. So in Ohio, we're sending another about $1 billion out to private schools, completely outside of our public education system. This isn't even the charter schools. These are private school vouchers and near universal system. So you see ed choice vouchers, you can have families earning, however much they earn, well over $140,000, you're going to get some portion of your private school tuition covered, right? And then you see these other programs that are essential for economic security, for the basic health and welfare of children, and you can see the income thresholds where those are capped, right? So $1 billion, about half of that going specifically to this ed choice voucher expansion, leaving this education system, okay? So here's some things that we're watching, all right? This is a little bit of a mix of federal stuff and state stuff. So right now there's a piece of legislation pending that would additionally cut funding, freeze funding to the 330 school districts that have joined the ed choice the lawsuit that asserts that that voucher program is unconstitutional. Cleveland Heights is one of those school districts. Sort of competing with that, there's this 653 that would limit ed choice vouchers to families making under $500,000, the most minimum of caps. Federally, we're watching the feds expand tax credits for people giving to scholarship granting organizations. So if you're giving to a scholarship program at a private school, you can now get a write-off on your federal taxes. Ohio has had that for the state for a while. So this is just expanding the money that's coming out of our general revenue, and going into private schools. And then again, there's the broad threats to the Department of Education, particularly the changes in Civil Rights Department and Civil Rights Enforcement. All right. I know that you all were also interested in work requirement changes in Medicaid and SNAP. This is going to be, I will link all of this, send it and drop all of these slides in the chat so you have these. This SNAP work requirement officially started February 1. You have until March 1. That's where they're going to give people a little on-ramp to this. The details are here. It's generally fulfilled by working about 80 hours a month or participating in a work program, training, doing community service. Included a little bit on what happens when you fail to meet this requirement. There are a lot of exemptions from this work requirement. Notably, veterans are not exempted. Parents of kids, of teens, not exempted. Kids aging out of foster care, removes eligibility from certain refugees. Medicaid recipients who are covered under Medicaid expansion are now included. All right. And then below you see who is still exempt from the system. Okay. Very narrow, much more narrow exemptions than we had seen previously. And really more narrow exemptions than what the state of Ohio itself had been intending in our Medicaid work program. So very, very stringent rules. Some tips on navigating this. One, please encourage people to watch for notices. ODJFS has to send out notices if they are in a category that's going to be part of this assessment. Watch for notices, make sure their addresses are up to date. All right. And then there are programs, and I hesitate to include this in these talks because I don't want this to be seen as an endorsement of the strategy that's being put forth. There should not be a work requirement with food. We do not have the capacity as a state to implement this with such accuracy that we can make sure that someone who needs food isn't getting inappropriately denied. We do not have the jobs infrastructure, the education infrastructure, the training infrastructure to just be like, hey, there's all these jobs, magically go get one. This is just this. I don't want to endorse work requirements as a strategy. However, if you are encountering people who are wanting some resources, some help in figuring out this work requirement, the state has some programming available. SNAP ENT, which is SNAP Education and Training, free training programs, career counseling services, personal supports that will be linked. Ohio Means Job Centers also has some assistance. Apprenticeships in Ohio, the state's made investments in apprenticeships. Some of them will have paid training, some options for folks, just as a trying to mitigate and get people resources informed about what's possible as this is coming down the pike. The Rural Hospital Fund, what I will say about this is that Ohio received the 5th lowest amount of funding per rural residents in the application-based portion of the award. So for all the grandstanding we have seen from our Ohio congressional delegation and our Ohio senators, 5th lowest amount. And notably, this money in this competitive portion of this is specifically disallowed for backfilling of budgets to use as operational supports. That is the kind of money that these systems, these hospitals are losing because of the Medicaid changes. And they are not, that is not what this money is about, right? So this is going to be a continuing problem. This fund is not going to cure what we saw in the holes created by the changes to things like provider taxes, all of the changes in Medicaid eligibility that we saw from the big, beautiful, bogus bill. Now, we've already seen a little bit of the consequences of this. We know Metro Health is rolling back charity care. They've had some cuts. This was starting to be announced just as the bill was passing. We've already seen consequences, not just for those rural hospitals, but for hospital systems right here at home in Ohio and Cleveland. like CBP folks, they were saying, mitigate, document, accountability, better policy is possible. In Ohio, we've got some really big inflection points, some really big opportunities, and people of faith do have a significant pulpit to talk about the harm and talk about what's possible here in this state. Now, we are nonpartisan. Uh, but the election in November, we can certainly work to get these issues at the top of the debate. And then gearing up for the 2027 state budget season, when we're going to start seeing all of those budget gaps start showing up in the state budget and then showing up in our communities as cuts, as cuts and greater economic instability, less security, just more families and people struggling. So I will stop there. I will include these resources. These are hot linked in your PDF, and we are just down the road. So anything more on this, we are happy to come out and do a deeper dive or walk you through it. Okay.
Thank you. Thank you, Hannah. Okay. Do you, Laura or Laura, Brianna, want to address any of the questions that were in the chat first, and then we'll take questions from the group. Okay. And if you need me to read those, one of the questions, I'll go in order, was in terms of, is there a date that new work requirements may take effect? I see Laura put in January 1st, 2027. And I believe that was it. Okay, so why don't we go to the floor? Anyone have questions, reactions, comments in terms of what you have heard? You can take yourself off mute. I think I hear someone trying, but I can't hear you. Scott?
Yeah, I'm wondering if there's a back sheet or something that would be of the high points of this that could be communicated through the churches to individuals in the communities about what's going on. Because I would imagine none of this is on anybody's radar individually.
I'll defer to Hannah to see if there's a one that they have, since, you know, obviously y'all are in state and so close to all of this. But I will, Brianna and I will drop in the link, state fact sheets that our organization developed that tries to list kind of the state impact across issues. I think that's a helpful start. And then, like, the work of, you know, that happens locally, it's looking at that, seeing if it resonates with your communities, making kind of modifications where needed. We also want to share our slide deck with you.
Yes.
We tried to make it accessible for everyday folks. So we pulled a lot of numbers out of the slides. It'll be in the notes section, but we're hoping that can be a resource that you all can take and kind of modify and use as needed to speak with your kind of communities.
So one follow-up question to that is, is that, it looks to me from my seat is that what they're counting, the people that are implementing this, counting on is people not signing up. Just this is too hard, and just that's the numbers estimating in terms of. So wouldn't a strategy be just to get people signed up and get their work requirements so that we can work down on the numbers that they're assuming where people aren't going to, as a strategy, as a question.
I think that's exactly right. I think that's one of the challenges or tasks, is just helping people try to navigate this and helping people find those resources to stay connected and to participate in what they are eligible and entitled to have under the law. And you're absolutely correct that is part of the strategy. These are very popular programs in America, in this country. Um, when you can't directly cut a program because it is too politically impossible and it's too much of a popular program, this is how you kill it.
Right.
You bit and piece it apart and then just make it so administratively burdensome that it's impossible to really comply with the rules. And so no one wanted headlines of hundreds of thousands of Ohioans without health insurance, but they could say hundreds of thousands of Ohioans failed to comply with this work requirement. And the failure is paperwork, didn't get a notice, right? And so this is part of the strategy of dismantling it, and a way to resist it is to help people get connected, to get the information, to navigate the hoops while we're trying to advocate for policy and political change.
Yeah, that's so right on. And I'll just add that they're counting on people to not notice that these are cuts, right? And for people to forget about things. So even the enhanced premium tax credits that Congress failed to extend, raise costs for over 20 million people across the country. Millions are going to lose healthcare coverage. They're counting on communities to just move forward, not notice, not connect the dots. So the work of this moment, of course, always starts with helping our communities, letting them know, getting them information so that they can feel as empowered as possible to try to protect their own care and access to food. And just a note on part of that work is letting folks know when things apply to them and when they don't. So we are worried about too many people dropping their Medicaid coverage thinking that work requirements apply to them when work requirements are targeted to the Medicaid expansion population. So that information is key. Um, you know, uh, so the work, yeah, is protecting people, connecting the dots for them so that this fast one can't be pulled on them. And then really it's about building strength so that we can insulate our communities in the future, work to reverse these cuts, but also create a different landscape where things like this cannot happen in the future. So I often say if we don't come out of this horrible time without having built more community power, we will have missed the boat on that. This is our time. It's an awful time, but this is our time to engage more people, educate more people, build stronger community coalitions. And I'll just pause there. I think there's a question
Yeah,
from Steve.
there's a hand, Stephen. You're on mute too, by the way.
Good morning, everyone. So I just had a quick question about just a clarification on the work requirement. So for Hannah's presentation, you say that it's been implemented February 1st, and recipients need to show that they meet these requirements March 1st. But there's something in the chat saying January 1st, 2027. Can you just clarify that, please?
Absolutely. So January 2027 is when the Medicaid expansion work requirement starts to be implemented. So that's for the Medicaid side of things. The February deadline is on SNAP, so that's for food assistance. And the folks who are in those categories for SNAP, for food assistance, the ones that are starting to be rolled out, they should get notices from JFS. And people who need food assistance should just apply. You should continue to apply. Don't self-select yourself out because you think you might have this work requirement and not be able. Apply, see what the deal is for your particular situation, and go from there. So to make matters complicated, these two things that people are probably ideally would get supports from both of these programs have different rules, different timeline implementation timelines for compliance. And so SNAP is earlier, Medicaid is later. Advocates here in Ohio are trying to at least get the Medicaid rules to align with the SNAP rules so people aren't trying to navigate two wildly different universes. But that's the difference there.
Thank you so much. Thank you.
Any other questions before we conclude? I see a hand up. Alan? You're on mute too, by the way.
Yeah, I was just wondering if anybody knows if the Cuyahoga County government is planning to do anything to assist people to meeting these requirements or, overcoming these cuts. I don't, does anybody know whether they're going to try to help?
I haven't seen any additional local county or city funding directed toward these specific cuts yet. I will say that the Cuyahoga County Job and Family Services Agency has tried to be a little more proactive in getting some of the resources and explainers out to people about what's coming down the pike, especially with the SNAP. But I haven't seen plans to backfill. What we're seeing though in Ohio is the resources. So even if they wanted to very aggressively try to solve this problem, the revenues coming into local governments are getting tighter as well. And so with these changes to property tax that have already passed the state house, with the state like tightening up its share of local government funds that go into our county or into our municipalities, with the ending of ARPA and a lot of those federal investments that came through the Biden administration, there's a real tightening happening at the local level as well. So there's some that sort of revenue crunch is happening sort of top to bottom in what the public sector can do.
Thank you.
Thank you. And so before we conclude, I just also want to know, if you were looking at this from an organization such as GCC, if either of you want to share, what are some priority areas? I think there is a lot happening. If you're an organization that has some relationships with the county, the city, who has these, close to 40 member institutions, as you look at this bill, the time frame we're in, what do you see as some priorities that you can give us to think through, in a short time frame to help us begin to do some groundwork and, just more deeper dive into this issue that we could possibly can begin to create some change?
So I do think the question about is there just a fact sheet that we can start sharing the basic information out is a great instinct and a great place to start, of communication, education of those closest to us in our world about what's ahead. Certainly CBPP and Policy Matters, we have lots of resources. You will also have a Center for Community Solutions in your backyard. So there's lots of avenues for some of that education and support, and just harm mitigation directly in communities. The other piece of it is that I think that telling this broader story about who's benefiting, and particularly around our tax situation and how that is connected at the heart of all of this, is an important one to provide to get people sort of enrolled in. That we're going to see a lot of talk about tax cuts, tax cuts, tax cuts. And if that's what the conversation is going into Ohio's budget in 27, all of this gets worse. And so in those spaces, whenever we are, maybe you're going to a candidate forum, maybe you're hosting a candidate forum, maybe you're doing civic engagement, having taxes and some of these major programs that are how does that work? What is your plan for education? How do you solve the childcare crisis when we're giving $17 billion away in tax cuts that are primarily going to the very richest among us? How does this work? So trying to elevate those questions in the public debate. And so many people, and me, gosh, you all, it's so disheartening right now, that it feels insurmountable, that the sort of old-fashioned things that we would do in terms of civic engagement just don't work anymore. It's harder, it's more frustrating. Speaking out in some instances in some states has been dangerous, even life-threatening and life-taking. So I don't want to undersell the difficulty of where we're at. But Ohioans moved three of the majority, three in the House in our congressional delegation, from being opposed to expanding these tax credits in the ACA to supporting it. Ohioans moved both Senator Husted and Moreno from being absolutely against it to both having their own bills that would solve this affordability crisis on the ACA. Now they're stuck on something else, but they moved. So that community pressure, regardless of party, still shows up in their political and policy decisions. So as hard as it is to stay engaged now, it's very important to do so. And it still is having impact on where people are voting, how people are willing to understand some of these issues.
Thank you.
I'll
Lori?
just add
Lori?
so quickly just the power of stories. We're grateful that you got through all the numbers and all the information we threw at you, but often having that story of somebody not having access to food can kind of say it all, a million words, right, in a moment. And for policy, shops certainly in DC, we don't have the community access to really be lifting those. So folks working in communities just always thinking about how to capture stories, share stories, to really bring to life the impact of these policies, and people can share them anonymously. There's a lot of different ways people can share their story. So that's the only thing I would add, and really thank you all for your activism and working on issues that matter to people, and for being with us today, and Brianna for the great presentation that she prepared, and Hannah as well.
Yes, thank you all so much. And thank you to our presenters. Thank you, Laura. Thank you, Brianna. Thank you, Hannah. Really appreciate this and appreciate our partnership. As we know, this is likely step one of many along the way, as we continue to develop this work. And GCC leaders, if you continue to have questions, you can send them directly to myself or Keisha or Megan to share with our three presenters today. And we will save this chat just to make sure that everyone gets the slides that was presented if you were not able to open them in the chat. Okay. Thank you all so much. We are a little 2 minutes over. So thank you for your time, and thank you to our presenters. We appreciate this information, and we'll continue to think and strategize around this as well. All right. Have a good afternoon. Good
Thank
day,
you.
everyone.
Thank you.
Bye.